Oh, I like these. These are
Are they
cute.
gonna cover my foot?
They do have a little bit of strap, so.
Okay, we can try it on.
Sorry. Thank you, Dad.
My name is Destiny. I'm 19 years old, and it looks like I have a ball sack on my foot. I was born with a benign tumor. After finding out, my parents took the precautions necessary to have that removed. And now I have a big mass on the bottom of my right heel that continues to grow over time. It's hairy, it's big, it's long. It looks gruesome. You can see the pores. I step on the outside of my foot. I don't like this. You see it, like how it comes out?
Too much.
Always so complicated. Oh, that's already a no.
Yeah.
This thing is ratchet. I'm not gonna, no.
Oh.
Here. I can only buy wide style gym shoes or wide style thick strappy shoes. Anytime that I wear an exposed shoe, people, they stare at my foot. It's a dream of mine to walk barefoot on a beach.
And I want you to be happy, feel good in your own skin.
Yeah. Dating? Ugh. I haven't had the best of luck for dating. I have to explain, this is what happened when I was younger, and I hope you accept me. I don't feel like someone's gonna want me because of what I have.
Hopefully, after you see Dr. Nassif and Dr. Dubrow, everything will work out, you know?
Right.
If they're willing to take it, so.
Let's just hope that Dr. Dubrow cuts this ball sack off.
Wow.
Yes, Habibi.
Check this out. So we have a patient named Destiny.
Ooh-wee.
Is that amazing?
Wait a minute, what the hell is that? Cool, that's her heel.
So Destiny had a lipoblastoma, which is a very, very rare, benign tumor in
Aggressive?
childhood that grows very rapidly. Let's bring in Destiny and see if we can help her.
Absolutely. Would you mind sending in Destiny?
Hello.
Destiny.
Nice to meet you, Destiny. Dr. Nassif.
How are you? Terry Dubrow, pleasure.
Maria?
Well, welcome.
Thank you.
I have a lot of your old medical records. It was called a lipoblastoma, yes?
Yes, that's what they called it. At first, like around 3 months, it was just like a pimple on her right heel. Several months later, I noticed it grew to the size of a marble.
And what did they tell you about it?
It was a benign tumor. It was just fatty cells.
Okay.
And they would have to remove it, and there was going to be a big gap.
And so pretty much the best way that it can heal is taking off a piece of her back and putting it on her foot, on her heel.
And it worked.
It worked.
So when I had my first surgery, and there's only 6 other people who have a lipoblastoma, and they wrote a case on mine.
Okay.
Medical journal. The medical journal.
So you're in the medical journal.
Yeah.
Wow. The surgery that Destiny had at 13 months of age was a very intricate microvascular transfer of tissue from her back to her foot. Even an adult, that's a really complicated operation. Imagine how complicated and intricate it is in a 13-month-old, where the nerves, the arteries and vessels are a fraction the size of adult vessels. Some really impressive surgical feats right there.
As she kept growing and she would gain weight, the flap would gain weight. So when she was, I think, 4 and 8, we went in to see the same surgeon, and they did
They did the bulking of it, so liposuction.
Just pure liposuction.
No, and then they also removed the excess skin. So it looked, again, like a very thin banana on her heel.
But when I went back when I was 14,
It grew again.
yes, they told me there's nothing new they can do. And at that point, I was like, I'm just gonna leave it. But it's just so much that I don't like about it. Okay, this is gonna sound a little vulgar. When you examine it, it's gonna look like a ball sack.
A ball
So
sack?
anytime somebody makes me upset, I'll be like, be quiet, because I'm gonna make you suck my ball sack.
Gross, but hilarious.
Yes.
Did you get bullied at all about this?
Just the other day, we were walking somewhere and someone came up behind me and took a snapshot of it. And
You're kidding me.
yes, it causes me to be extremely insecure.
And self-conscious.
And self-conscious because I am in this phase of my life where I grow into a friendship or into a relationship or network, and things like this stop me because I'm like, okay, if I get too close to them, then they're going to invite me to a beach. They're going to invite me to a pool party, and I'm not gonna go because of it.
Some people do about things they're insecure about, you joke about them, but really that joke is just a thinly veiled
Right.
way of covering your pain.
Right, yeah.
Well, I will tell you, it's super complicated. And I don't want to take you to the operating room and then kill the whole thing. So Interesting. This looks to be skin and then all of that back tissue. And that's why I think it gets bigger and smaller as you gain and lose weight. The way you debulk a free flap is you generally make an incision along here. You don't want to go near here because this is where the artery and vein are coming in and going out. You lift this up and remove a huge chunk of the bulk. The bulk is from the fat.
Okay.
If we are to debulk this, if we don't want to come back, if we can take cautery to essentially burn the tissue, I can potentially prevent the flap from growing back again, okay? I would imagine if I'm able to successfully remove the proper amount of the bulk, that we'd end up removing this amount of skin too, which would make it cosmetically way better, okay? The risk of doing that is that you kill the whole thing. And if you kill the whole thing, you'd have to have another free flap. You don't want to bump off the blood supply. And it's really important that you preserve the ability to evert and invert your ankle and keep being able to flex and extend. I think this needs another set of hands and eyes. My other best friend,
Besides Dr. Nassif.
besides Dr. Nassif, truly, my other best friend is a gentleman named Dr. Scott Foreman, who is an extremely gifted foot and ankle specialist.
Okay.
You want to do this?
Yes.
All right. Although this is a high-risk case because the potential to disrupt the blood supply to Destiny's flap and have the whole thing necrose and die is high, I think I'm really interested in helping her because she's 19, she's got a long way to go, and it's affecting her both functionally and cosmetically. It does look like a testicle a little bit, I must say.
So should we give it a moment of silence for the ball sack?
Let's just look at it a little bit. Say our final goodbyes.
We're very nervous. She's making all the decisions for herself this time. We're just basically here to care for her, love on her.
We're just hopeful that the outcome is something that she's happy with.
Hey guys. Hey. How are you? He not only is a specialist in foot and ankle surgery, he's also was my best man and I was his best man. Nice. So
you go way back.
Obviously the reason I wanted him here is because this is a very specific situation with a lot of potential pitfalls that I want to avoid. It's a no-brainer to have him here and I need him here. Today for Destiny's surgery, we will begin by making an incision along the medial side of her foot and carefully opening up the flap. Next, we will debulk the flap by cutting away some of the fat pad and cauterizing the tissue, so it hopefully won't grow back. Then we will remove the excess skin, leaving Destiny with a functional and nice cosmetic result.
Hello.
Hello, everybody. Hello, you two.
So I made the incision, I lifted everything up, and we carefully removed as much tissue as we could that we felt was safe to give you the contour you want.
Okay.
And to try to keep the blood supply intact. This is a very large skin flap that has the real potential to turn purple and then black and die. What I'm hoping to see is viable, pink, healthy tissue with good blood flow, which means it's surviving and thriving. It's like unwrapping a present. I hope it's a good present.
Oh, yeah, me too.
This is exactly what I don't want to see. So,
Take that deep breath because this is very nerve-wracking for us. Purple is a little something that I'm used to dealing with.
I can definitely see the flap does look very purple and scary. I'm concerned.
when it's purple like this, that indicates that it's more blood having trouble getting out. We would like to be able to somehow suck the blood out of this skin, like a vampire.
Wait, are you gonna put leeches on it?
Ladies and gentlemen, we're gonna put leeches on it. We don't want this to croak.
Okay.
It's all fun and games until the whole thing turns black and dies.
Hi.
This is Irina,
Hi.
AKA the leash lady.
That's gonna be so gross. Yeah, I don't like bugs. I don't like little insects. I just feel weird. It looks like a worm. Oh, I don't wanna
Are they
look.
biting your
I
finger?
don't wanna look.
No.
and just seeing the leeches latch on, it was just disgusting.
You see, they like to sit close to each other.
Yes.
They kind of compete. They're very interesting animals. Maybe they don't look pretty, but they do amazing work. To be honest.
Oh.
Don't worry, honey, I'm here. Okay, perfect, perfect.
Oh, nasty. Are you taking a selfie?
Leeches are doing a really good job for us because the flap is slowly changing from purple to pink, viable, healthy tissue.
That is so fun. I love that.
But we're not out of the woods yet. We need blood to continue to go in and out of the flap, and I need to make sure we do everything we can post-operatively to continue this early positive progress. You're awesome. Thank you.
Thank you so much.
Thank you.
Thank you. When I look back and just see what it took for me to get to where I'm at today, having 3 surgeries on my heel, then I have to live with an entire ball sack on my foot, it was embarrassing, and it caused me pain and deep insecurities within myself.
This is my destiny.
Now, my foot is just perfection. I'm going out barefoot or I'm going to wear some sexy heels. And when I don't have to look around me and see if people are looking at me or taking photos of me, I no longer look at my gym shoes anymore. Those are like in the back of the closet. I have new shoes and I'm just living life. Walking barefoot at the beach feels like I have freedom and it feels awesome.
You guys see this masterpiece? I love it. It looks great.
It's so pretty.
I'm so proud of you that you went through this whole process and now not having to hide it from anybody.
Yes. Before my surgery with Dr. Dubrow, I had a skin flap on my right heel that had grown into a bulging, hairy abnormality. Thanks to Dr. Dubrow, I have a beautiful ball sack-free foot. Thank God.
Do you feel like you're missing something? Like since it's gone? Like since you,
No.
because you were used to walking with a.
It was time to remove it.
She's just glowing.
It kind of actually scares me because now it's like she's not that timid about going out anywhere now. Now she wants to like go and explore the world and go out and have fun. And then it's like, okay, let's go back to where you were before.
You never see me in the house anymore.
I know, bring it down a notch.
No. So I have a boyfriend and it's cute. That's what's going on.
That was holding you back, that ball sack. But now it's like, you got a tuck.
A ball sack
tuck.
Now that it's gone, and I can just grow as a happy girl and living life the way I should have been doing. We had to go shoe shopping, Dad.
You get a summer job.
A summer job?
Hey, what's going on, man? How you doing? Good to see you, man.
Good, how about you?
What's up, best friend?
Hey, how you doing?
Good, good.
You know what I like?
Yes, sir, yes, sir.
My name is Andre. I was born with a condition called microtia. It's when your ears are deformed and smaller than normal, which has ultimately left me with a keloid on my left ear. Some people say that it looks like a golf ball. Some people say that it looks like a snail. But no matter what you call it, I just want it gone.
Was it always that big, or did it seem to grow?
It was pretty small when it first started out, but then it got bigger each year up until now.
So like, let's say like, okay, a year from now you're completely healed, like the keloid's gone and all that. Are you gonna like go and like start dating everybody?
Yeah, definitely. I'd be more open to it. The keloid definitely impacts dating. I don't like to pursue anyone just because I think in my mind I'm going to get rejected. They're not going to want someone with this giant keloid on their ear.
Middle school was rough, I remember. That was when like the group of guys was kind of like mean, right? Was that 8th grade or 7th grade?
That was definitely 8th grade.
It's so sad how cruel kids can be.
I know.
When we were little, I witnessed Andre go through quite a lot of bullying. We had people even saying things to his face like, what's on your ear? What is that? You have cauliflower ear. Why is your ear so ugly? But we made it. We made it.
We did.
Come here. What is that?
Put your hand on my back, upper back.
You're kidding me. You have a thing to tell you to sit up?
So it's a little thing you stick in the middle of your back.
Yes.
Then you have to set your posture.
What do
By
you-
the way, my height actually increased by about ½ an inch.
Why don't you just sit up straight? The best way to get Paul to stop slouching is not by putting a device between his shoulder blades, it's by putting an ice cream cone just above his head.
So we have Andre, a young man born with microtia, had reconstruction, and he's developed what?
Keloids.
Keloids.
Oh, poor guy.
Let me show you a photo.
Oh.
In simple terms, the keloid is overgrowth of scar tissue. And when you just cut it off, your body says, hey, there's still a wound here and it keeps growing. So it's very hard to excise and not have it grow back again. Can you please send in Andre?
Andre.
This guy's tall.
Nice
Andre.
to meet you.
Nice to meet you.
Hi, Andre. Terry Dubrow, how are you?
Hello.
Nice to meet you.
Nice to meet you.
Hi, I'm his mom,
Is
Malika.
Malika, Dr. Nassif, Dr.
Terry
Dubrow.
Dubrow, how are you?
Hi, Dr. Dubrow.
Nice to meet you.
Come on
Come on
in.
in.
Have a seat there.
My mom, she's a single mother. We have a very close relationship. She was always encouraging me to just make the most out of a bad situation. I know that it's straining to her to maybe go through another procedure again with the same results. If Dr. Nassif can't fix this, then I'm just gonna have to live with it for the rest of my life.
So you were born with a problem with your ears?
Yeah.
Okay.
It was a unique situation when he was born. There's something wrong with his ear. And I'm like, is it something I did? Because
No,
I
you
worked in
did
a
nothing.
pharmacy. It's like, was it a medicine I was probably exposed to before?
Okay, listen to me.
Uh-huh.
You had nothing to do with this.
Okay.
It just happened.
So is it
'Cause
just
I
something that
always
happens
blame
randomly
myself.
then?
Yeah.
I mean, there's not one specific reason why microtia occurs.
So
Thank you.
if you've ever had any guilt,
I did.
has nothing to do with you.
Microtia could be a congenital thing, or it could be environmental. Many factors can cause this, but you can't really pick out one specific factor.
The Children's Hospital referred me to a doctor, and he examined him. He was like, we can't do any surgery until he's 5. So we waited till he was 5. That was the worst surgery because they had to get cartilage from his rib.
Do you remember it?
I do, yeah. I just remember I was in pain.
How old were you when you got that keloid?
9 or 8, I would say.
He was like, Mom, I don't want any more surgeries. But now if you can see, it's like literally growing over his ear to where it's covering some of his ear. And
I can tell this bothers you just as much as it bothers him.
Definitely. No matter how much people say that they don't look at the outside, they do, and they judge you by that. As a mother, I just tried to esteem in him that he's loved, he's accepted, that that's just the outside. How you are on the outside doesn't reflect who you are on the inside. But Andre is kind of withdrawn a little bit. I feel he is limited by the outside appearance.
Does it interfere with any glasses or any activities of any kind?
I wore glasses, and thing about it is I didn't really have like
A rim?
Yeah, a rim.
So what would be your goal right now?
Really just to get it looking as much like this ear as it could.
I would like
of
it to look exactly like that. We want perfection.
Bring it down a few notches, Mom. Bring it down.
The doctors are in the business of making miracles and miracles.
You would be okay with not perfection, right?
I'd be okay if we get close to it.
Both of you.
No big deal.
Yeah, of course. All right, so we're gonna take a peek here. Okay, so it is attached. You're missing the area up here. And that's right, this is the reconstruction. We got really lucky here because Andre's keloid is attached through a small pedicle to the top of his ear. It's not engulfing and eating his ear, because if we had to remove a keloid that is eating your ear, then we're lopping off the top third of his ear. What is our goals from what you both wanted? You said, can you remove the keloid and make your left ear look like your right ear? Right?
Yes.
Right.
Okay. Probably not gonna be able to make them look exactly alike,
Yeah.
no matter what.
Okay.
So a plan would possibly be doing a keloid excision with possible rib reconstruction,
Okay.
assuming that the keloid doesn't grow back. A thought that's entering my mind is, if I put rib in between the keloid and the skin, is that gonna act as a barrier to prevent further regrowth of a new keloid? And yes, I just thought about that myself.
Are there other treatments that can stop the keloid?
There is one thing. There is something called 5-fluorouracil. It is an injectable. It helps prevent the buildup of scar tissue. There is a possibility that this modulator, which means it tells things to stop growing, may be effective. I would inject the 5-FU at the end of surgery, and every week until hopefully that initial healing stage is over.
Ears are basically either there or not, generally. Name me an actor or actress who has great ears.
Can't think of any.
You know, it's just not a thing.
Hello, everybody. let's talk about the plan for today. The goal is to remove the keloid, inject it with 5-fluorouracil and steroids to prevent it from coming back. However, the risk of you getting that keloid back is still there. There are no guarantees in any of this with what you have. There's no guarantee here. For Andre's surgery, I will start by making an incision along the left ear and excise the keloid from his ear. Then I will harvest 2 small pieces of rib and stitch them to the tissue on top of his ear. I will then use a piece of skin from the keloid to make a skin graft to cover the rib and shape the ear, before stitching the area closed. Finally, I will inject Andre's ear with 5-fluorouracil to prevent the keloid from coming back.
Hello, Dr. Nassif.
How are you?
Good, how are you?
Andre. Hey, buddy. So I haven't seen Andre in a month, and we did a surgery. His post-op checks were great. After the keloid was removed, I put 2 nice pieces of rib in there, so it really would be a lot easier for you to wear your glasses. We have to be careful about making sure that skin graft lives. 2, I want you to keep that dry. Just leave it alone. Don't touch it, don't instrument it. But a few days ago, he sent me a photo which showed that his skin graft was separating from the top of his ear. So what's happening?
Well, I was in the shower and then I got out and then I started to clean the ear with the peroxide. And then the scab peeled off completely and then that's when I yelled I was like, Mom!
Peroxide.
Yeah. Is that bad? Or?
But peroxide on tissue, it actually kills it. Well, let me take a look, okay? Okay. It looks like there's a piece of rib that Dr. Peng can work with to prevent the keloid from growing back.
Okay.
Okay? So we're gonna prep it, give you a little shot there, numb it up, and then stitch it. It's not gonna take long.
Okay. So when the skin graft came off after the shower, I was petrified because a keloid does have potential to grow back. Hopefully we could just get this under control and it just stays away for good.
So the first part I'm looking at is kind of the piece of cartilage. I'm gonna see how much of it we can save, but I took out the top layer of it. You're all done.
Oh, really?
Yeah. Let's put this off.
In an instant, life can change. Your world can get rearranged, and you know that things will never be the same.
This is the first time in my life that I have 2 normal-looking ears, and it's just kind of like a rebirth. Growing up with microtia and the keloids and being bullied constantly, it's always been a factor and something that's held me back. This is my first spring break that I'm going on a trip. Right now, I'm just feeling optimistic about meeting new people, maybe even find myself a date.
I am so excited for this trip. I cannot believe we're finally going on it.
I feel like I can let go now.
Yeah.
I feel relieved.
Yeah, it seems like unreal. Like we're really.
Yes, it does. It's like a dream
about to
come
hop
true.
on a plane.
For both of us. Oh, here's Andre.
Look at my baby.
Oh my God, you look so
Still my
good.
baby.
Are you ready?
I'm just so excited I get to go on spring break with a brand new ear.
Yeah. A difference that I have seen in Andre is the way he carries himself. Before the surgery was, I want to be able to do this, I wish I could do this. Now I'm seeing and hearing a lot more, when I do this, I'm doing this, let's go do this. His whole demeanor has honestly changed.
I have a little something for you.
Oh, wow.
Yeah, let's see what it is.
Open it, open it.
Oh, that's so nice.
Try him out, try him out.
Oh, wow. Look at you.
Okay, now we're ready.
Now you can go.
Yeah.
Before my surgery, I had a big, horrible, snail-looking keloid on my left ear. I would constantly get stares and questions about my keloid that made it impossible to forget about. And I couldn't even wear glasses. But now, thanks to Dr. Nassif, I'm keloid-free, and instead of feeling the shade of people staring, I'm now wearing my shades all day. Now, look at me.
Wow. Okay. Who is that?
I'm just really excited that I get to go to a beautiful city like Paris looking beautiful for the first time.
Have fun.
Bye.
I miss you.
Miss you more.
Call me 5 times a day.
No.
So the bumps, it just looks weird. My name is Bruno, and I have two squishy, enormous bumps on my chest. When I run, they kind of...
Oh, wow, look at this. This is good for a surf trip. After Dr. Dubrow can fix you up nicely, there's a miracle worker.
I was born and raised in Lisbon, Portugal, and I started surfing around 8. Not too many years after I started, noticing the bumps.
Wonder what's inside, what do you think?
Well, I keep hoping no aliens. That's ready to come out. Back then, I was concerned with how the bumps look. Later on, I was concerned with the bumps getting painful, and nowadays I'm concerned that they develop a cancer. I don't want to be dramatic, but it's pretty much, for me, it's like repetitive wounds. They naturally evolve to something serious.
It's about time to take care of them.
Yep. And tell us what's really going on.
I know.
I did CT scan, I did an ultrasound, doctor after doctor in Portugal and the US, and never seen this. We have no idea what it is. Told me the bumps would not be a health risk, but again, they didn't know what it was. So I was never 100% comfortable. Some age that you are aware of your mortality. Now getting older, and I know that I'm not invincible. I don't want them developing into something more serious that could take me out of the water forever.
Cute little story for you. So, I go to bed the other night. You know, you have the night mode on your phone. I shut it off. Gavin buzzes through. He's at his mom's house. Dad, there's someone in the bed next to me. What? Because there's 2 beds in his room. He goes, yeah, there's someone snoring in the bed next to me. I go, well, who is it? Did you go look? He goes, no, I don't want to go in.
It's scary, yeah.
So he calls Kyle.
Security guy?
So, yeah. He comes up, Kyle and Gavin behind him.
Okay.
You know, I was gonna take a little flashlight. It's Adrian, his mom.
It's Adrian? I don't know what's more frightening, waking up to a strange person in the bed next to you, or thinking that lame Paul is gonna save you. This is really interesting. It's a super big medical mystery.
Oh, geez.
But he's got these 2 mass-like structures, one on the left upper abdomen and one on the right upper abdomen.
But wait a minute, can't they just simply get a CT scan or MRI to see what the hell it is?
That was the first question I asked, looking at his history, and you know what the CT scan shows? Nothing. Why don't we bring Bruno and get a history and figure out what we can do for him?
Sure. Can you please send in Bruno?
Bruno!
Hey.
Bruno, how are you?
For Bruno, this is his last opportunity. Both doctors are the best of the best, so after this, don't have any more options. So it would be very concerning if we don't have answers today, for sure.
You have a sort of a mystery component to what's going on with you. When did you first notice these masses on your abdomen?
I started surfing at 8, and I think these things start growing since then. We were looking at pictures. I think I have a picture like at 12 or 13. You could already see like the bumps growing.
You didn't have it before you started surfing?
I don't think so.
When you say surfing, are you saying a lot of surfing?
I was a pretty famous surfer. I traveled all over the world since I was 16, and I was the first Quicksilver team rider in Europe. And when I was 18, I went to the university. I was the Portuguese champion. I was professional till 27, 28.
Bruno actually beat Kelly Slater once.
Oh, really?
You beat Kelly Slater. And you know what I say to that? Shaka, bra. Shaka, yeah, yeah. By the way, you still surf?
That's kind of the reason of my life. Like, I work and then I want to, or we want to go surfing.
You surf too?
Yes.
That was also part of the connection. Sure. It's handy that your wife likes the same stuff.
It is handy.
Dr. Dubrow and I, you know, we have our own hobbies together, and that's basically him insulting me and me just kind of letting it go one ear out the other. I don't know if we want to consider that a hobby, but that's one.
Do you usually wear a wetsuit?
Almost always, because if not, it gets worse much faster. Because bumps, they get bruised and they start hurting. And at night, I cannot lay down on my stomach. It becomes very, very painful.
If that's getting bruised, and that's not really soft tissue as much, that's rib right there. It's cartilage usually, unless it became ossified. Is it osteomas?
Well, if it was an osteoma, the CAT scan would show it. Our minds are going places. We're like medical detectives for the moment. There's a thing called differential diagnosis in medicine. What are the possible diagnoses that this thing could be, from most likely to least likely? And when you have to form a differential diagnosis, it usually means the diagnosis is not obvious. But you had a CAT scan, and it didn't show anything.
Yeah, so this is the crazy story. So 20 years ago, I tried the liposuction. After 2 weeks, I thought, now I'm going to look normal. And it was just the same.
It's very weird, isn't it?
That's why I want to see it.
Stand up for a second. This one, it's soft and it's
boy.
distinct from the rib too. This one looks bigger.
This one is bigger.
Than this one. So when you're lying down sometimes it probably goes right over. And that's when it hurts?
Yeah.
These masses feel like balls of fat. I've never seen anything like this before.
Have a seat. So, what is the differential diagnosis? What do you think's at the top of the list? What would you say?
Lipoma.
He thinks it's just lipomas, fatty tumor.
A fatty tumor. Okay.
Right. I don't think it's necessarily that.
Okay.
I think you would probably see a fatty tumor on a CAT scan, particularly when they're this big. I think, see if you agree with this, and you don't have to. And if he doesn't, he's wrong, you know.
He's wrong.
And we'll just, you know. So I think it's, wait for it, paradoxical fatty hyperplasia. Think about cool sculpting. There's this phenomenon when it comes to fat. You can, instead of doing liposuction, you can put these freezing devices on. It's called cryolipolysis. It kills the fat through freezing it, and then it dies, and then you urinate it out. But 3 to as much as 10% chance that instead of it dissolving the fat, it causes the fat to grow up. Yes. I don't have one of these freezing machines, but I have seen this dozens of times. My theory is that all of the trauma that Bruno's chest has sustained from that surfing has caused the masses in his chest. Usually, you would think it would cause atrophy or a reduction in fat in that area. But in his case, it's caused a more rare form of paradoxical increase in the amount of tissue, which is very unusual, but very interesting. Now, what's confusing though, is that if I am right, and it's paradoxical fatty hyperplasia, the liposuction should have worked.
No change, that's the weird part.
Very weird. So we have our differential diagnosis of, and I think it's paradoxical fatty hyperplasia. I think most doctors, like Dr. Nassif, would think it's a lipoma. I think that's second on the list. And then there's a third oma that's possible called a fascinoma, where we don't know what it is, but it's totally fascinating. Either way, it has to be operated on to remove it. We do a tummy tuck. You make an incision, lift it up, take the whole thing out, and pull down the excess skin. And in your case, the advantage of that is that all of this would be gone. The skin would be all tight.
I never imagined I would get a tummy tuck. I am very excited. Now I'm gonna get some breast implants and pointy ears.
We have to take it out because I don't know if they're going to undergo malignant degeneration or not in transformation.
That's concerning, yes.
If masses are left around for a long enough period of time, there's always the potential for them to turn into a cancer. That's why during surgery, I'm going to have to take a sample of it, send it off for pathological analysis, and make sure it's nothing really dangerous.
I'm going to look like Ken.
Bruno, how are you, my man? So here's what we're talking about. This mass goes all the way from here, here, and this one is about this big. So the question is, Bruno, what the hell is that? I'm excited to figure this out. When you do a case like Bruno's case, you really never know what to expect. Could it be that paradoxical fatty hyperplasia? I don't really know. So it's right now a total mystery. Today for Bruno's surgery, I'll begin by liposuctioning the fat on both sides of his flanks. I will then make an incision across his lower abdomen, elevate up the abdominal wall and remove the masses, and then send a sample off to pathology to confirm what it is and if it's cancerous. Lastly, I will remove the excess skin before closing him up. Bruno, Sarah, how are you?
Good, thanks.
How do you feel?
Well.
Yeah, good, except for that. Okay, so what I need to look at today is to see whether I've impaired the blood supply of the skin, particularly in the left upper quadrant. Let's look at that. This is the area that was of concern, but that looks totally okay. You can touch here.
Can I touch?
Yeah.
I never seen it without the
I know. And feel this. This is not the mass. That's his ribs.
Oh my God.
Right? That's pretty good, right?
Look at that.
Rockstar.
You happy?
I'm happy.
Yeah.
Very happy. Yeah, just seeing myself with no bumps, it looks much better. And above all, it looks normal. Actually, I was waiting 35 years for this day, so very happy, impressive.
What did you see when you got in there?
It sort of popped out individual little barnacles growing on the side.
It wasn't firm like that, though.
Part of it was very firm. I've never seen this before. This was bizarre. Let me show you.
Oh my God.
Look at these things.
Remove.
Ay, ay, ay.
I mean, it looks like coral. That's freaking weird.
There were no distinct planes between that mass and the surrounding tissue. It was involved in the surrounding tissue, which is very characteristic of a malignancy. They grow in and invade. It sort of had that feel to it. We'll know in about 3 days what the story is.
I'm super anxious. There was some real weird stuff inside. The aesthetic part is one, but I was really worried of cancer or some serious illness. And now we know that this is very possible.
We await the pathology result.
Okay.
We finally got the pathology report back, and it showed that the masses were an overgrowth of fatty cells, which is consistent with paradoxical fatty hyperplasia. So Dr. Dubrow was right, and the best part, no cancer, thank God. So the mystery is finally solved, and hopefully there will be a lot of surfing trips in my future. I cannot actually remember the last time I surfed without feeling pain. Today I was able to surf laying down on my chest. The bumps, they're gone. Absolutely amazing. And my masses are cancer-free, so I just feel more connected with the ocean.
But when you catch a wave, you gotta surf.
Good to be back, huh?
Super happy. Look like a normal person now.
Yeah. I think he feels comfortable and confident, and I'm just happy for him and enjoy being healthy.
What a difference, right?
Look like a skinny bitch now.
Not that skinny, just normal, I think. Before my surgery, I had 2 huge masses on my chest. But now, thanks to Dr. Dubrow, the masses have been removed, the pain is gone, and I can now enjoy the sport I love. Dr. Dubrow and Dr. Nassif, they changed my life for the better. I cannot thank them enough.
Let's go.
Yep.
Let's go. Let's get on it.
I have so much to look forward to. Surf trips with Sarah, that's what I will live for.